Leg strength becomes increasingly important after age 50 for maintaining independence, preventing falls, and supporting joint health. Today we're covering 2 isometric leg exercises building lower body strength through static holds, wall sit for beginners and horse stance for advanced practitioners. These exercises strengthen multiple leg muscle groups through sustained muscle engagement without joint movement. When practiced correctly and consistently, they can help build leg strength, improve muscular endurance, and support functional mobility. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises, especially if you have knee problems, hip issues, balance disorders, or cardiovascular conditions. Understanding leg muscle groups and isometric training. The legs comprise multiple muscle groups working together for functional movement. Key muscle groups include quadriceps, front thigh, for standing and stair climbing, hamstrings, back thigh, for knee flexion and movement control, gluteal muscles for hip stability and power, adductors, inner thigh, for lateral stability, calves for ankle strength and push-off, and core muscles for postural support and lower back protection. Comprehensive leg training should address multiple muscle groups rather than focusing exclusively on one area. Isometric exercises involve muscle contraction without joint movement, building strength through sustained static holds. Research shows isometric training effectively builds muscular strength and endurance, may provide cardiovascular benefits including blood pressure reduction, places less stress on joints compared to dynamic movements, and builds mental endurance through sustained effort. These 2 exercises represent progressive difficulty levels from beginner to advanced isometric leg training. Exercise 1, Wall Sit for quadriceps strength, beginner level. The first exercise is wall sit building quadriceps strength through supported static hold. This beginner-friendly exercise primarily targets front thigh muscles while providing wall support for safety and stability. Here's how to perform wall sit safely. Stand with back flat against wall. Position feet shoulder width apart approximately 2 feet away from wall. Slowly slide down wall by bending knees. Lower until thighs are parallel to floor with knees bent at 90 degrees, or to comfortable depth. Ensure knees stay directly above ankles, not pushed forward over toes. Keep head, shoulders, and back against wall throughout hold. Maintain this position while breathing steadily and naturally. Hold for 20 to 30 seconds initially. That completes one hold. Rest 30 to 60 seconds. Perform 2 to 3 holds per session. Gradually progress hold duration to 60 to 120 seconds as strength improves. Practice 3 to 5 times per week. Essential technique reminders: maintain knee position directly above ankles throughout. Keep back flat against wall for support. Breathe naturally, don't hold breath during effort. Avoid pressing hands on thighs, let legs support position. Stop if experiencing sharp knee pain. Modifications: for knee discomfort, maintain higher position with knees bent less than 90 degrees. For progression, increase hold duration gradually or try single leg wall sit when ready. What to realistically expect: with regular practice 3 to 5 times per week over 6 to 10 weeks, you may notice strengthened quadriceps for standing and stairs, improved muscular endurance in front thighs, enhanced mental endurance through sustained holds, better preparation for more advanced leg exercises, and improved confidence in leg strength. Wall sit provides accessible entry point to isometric leg training. Exercise 2, Horse stance for full lower body integration, advanced level. The second exercise is horse stance building comprehensive lower body strength through unsupported static hold. This advanced exercise challenges entire lower body including quadriceps, glutes, adductors, and core while improving balance and mobility. Here's how to perform horse stance safely. Stand with feet wider than shoulder width apart, approximately 1.5 times shoulder width. Turn feet slightly outward approximately 30 degrees. Slowly bend knees and lower body as if sitting into invisible chair. Aim to lower thighs as close to parallel to floor as comfortable while maintaining upright spine. Keep chest open and shoulders relaxed. Position hands in front for balance, either in prayer position or extended forward. Hold this stance while breathing deeply and steadily. Hold for 20 to 40 seconds initially. That completes one hold. Rest 60 to 90 seconds. Perform 2 to 3 holds per session. Gradually progress to 60 to 120 seconds as strength and stability improve. Practice 3 to 5 times per week. Critical form points: keep knees tracking in line with toes, don't let them collapse inward. Engage core and gluteal muscles to support upright posture. Maintain spine upright, don't lean forward excessively. Breathe deeply and continuously throughout hold. Use nearby wall or chair for light support if needed for balance. Modifications: for limited strength or balance, reduce depth of stance maintaining higher position. For balance concerns, practice near wall or sturdy chair for support if needed. For very limited capability, start with wall sit building to horse stance over time. For progression, increase hold duration or deepen stance gradually. What to realistically expect: with regular practice 3 to 5 times per week over 8 to 12 weeks, you may notice comprehensive lower body strength development, strengthened adductors, inner thighs, often neglected in other exercises, improved hip mobility and flexibility, enhanced balance and proprioception, better core stability and postural control, and increased mental focus and discipline. Horse stance provides advanced full-body lower body challenge. Comparing wall sit and horse stance: wall sit advantages: provides wall support for safety and stability, excellent for beginners or those with balance concerns, specifically targets quadriceps effectively, easier to learn proper form, and clear progression path through hold duration. Wall sit limitations: primarily works quadriceps with minimal adductor or core engagement, wall support reduces balance challenge, and limited mobility or flexibility development. Horse stance advantages: engages entire lower body including quads, glutes, adductors, and core, no external support, builds balance and proprioception, improves hip mobility and inner thigh flexibility, develops mental discipline and body awareness, and provides comprehensive functional strength. Horse stance limitations: more challenging, requiring better balance, harder to maintain proper form without support, may be too advanced for beginners, and requires more body awareness and control. Both exercises have value at different skill levels and can complement each other in progressive training program. Creating progressive leg strengthening routine: here's how to integrate these exercises progressively. Beginners, weeks 1 to 6 start with wall sit exclusively. Practice 3 to 5 times per week. Begin with 2 sets of 20 to 30 seconds. Progress to 2 to 3 sets of 60 seconds. Focus on proper form and breathing. Intermediate, week 6 to 12 continue wall sit while introducing horse stance. Alternate exercises or perform both in same session. Wall sit, 2 to 3 sets of 60 to 90 seconds. Horse stance, 2 sets of 20 to 30 seconds with support. Progress horse stance duration and reduce support gradually. Advanced, 12 weeks and beyond emphasize horse stance while maintaining wall sit for warm-up or deload weeks. Horse stance, 2 to 3 sets of 60 to 120 seconds. Include variations like pulse holds or single leg progressions. Continue both exercises for comprehensive leg strength. Essential safety considerations: these isometric exercises require appropriate caution. Stop any exercise causing sharp knee pain, significant joint discomfort, dizziness or lightheadedness, chest pain or difficulty breathing, or excessive muscle trembling beyond normal fatigue. You should not perform these exercises without medical clearance if you have recent knee or hip surgery, severe arthritis with constant pain, uncontrolled high blood pressure. Consult doctor as isometric exercise affects blood pressure, significant balance disorders, or acute lower body injuries. Always practice on non-slip surface with nearby support available. Start conservatively with shorter holds and progress gradually. Listen to your body and respect your current limitations. Complementary practices for leg health: these exercises work best combined with adequate protein intake, 20 to 30 grams per meal, supporting muscle repair and growth, sufficient calcium and vitamin D for bone health, magnesium and omega-3 fatty acids reducing inflammation and muscle cramps, proper hydration supporting muscle function and recovery, regular walking or light cardio for cardiovascular health, gentle stretching maintaining flexibility, and adequate rest allowing muscle recovery and adaptation. Avoid prolonged sitting, stand and move every 30 to 60 minutes. Practice balance exercises like single leg standing. Include varied movements throughout day for comprehensive leg health. Realistic expectations for strength development. Muscular strength and endurance improvements occur gradually with consistent practice. Weeks 1 to 4, learning proper form and technique, initial muscle adaptation, building mental endurance for holds, some may notice improved exercise capacity. Weeks 4 to 8, exercises feeling more manageable, noticeable improvements in hold duration, strengthened targeted muscles, enhanced confidence in leg strength. Weeks 8 to 12 and beyond, clear improvements in muscular strength and endurance, better functional leg strength for daily activities, established sustainable routine with continued progress, enhanced overall leg capability and confidence. However, maintaining strength requires ongoing consistent practice. Stopping exercise leads to strength decline within weeks. Monitoring functional progress. Track progress through both exercise performance and functional improvements. Exercise metrics: increased hold duration for wall sit or horse stance, ability to progress from wall sit to horse stance, improved form quality and control, and enhanced mental endurance during holds. Functional improvements: easier stair climbing and chair rising, improved walking endurance and confidence, better balance during daily activities, reduced leg fatigue during routine tasks, and enhanced overall functional mobility. These functional markers indicate meaningful strength gains supporting independence and quality of life. When TO seek professional help, consult healthcare provider or physical therapist if you experience persistent knee or hip pain during exercises, significant balance problems affecting safety, inability to perform even modified versions, or no improvement after 12 weeks of consistent practice. Physical therapist can provide personalized assessment of leg strength and balance, specific modifications for your conditions, comprehensive exercise program appropriate for your needs, and treatment for underlying issues affecting performance. Conclusion: these two isometric exercises, wall sit and horse stance, provide progressive leg strengthening from beginner to advanced levels. Wall sit offers accessible quadriceps strengthening with wall support, ideal for beginners. Horse stance provides comprehensive lower body challenge engaging entire leg musculature for advanced practitioners. Start at appropriate level based on your current capability. Practice 3 to 5 times per week consistently. Progress gradually increasing hold duration then difficulty. Use proper support for safety as needed. Maintain realistic expectations about progression timeline. Combined with regular walking, proper nutrition, and comprehensive healthy lifestyle, these isometric leg exercises can build lower body strength, enhance muscular endurance, and support continued functional independence and mobility. Thank you for watching. For specific concerns about appropriate leg strengthening exercises for your situation, consult with physical therapist or healthcare provider for personalized assessment and guidance. Subscribe for evidence-based information on strength training and functional fitness for older adults, practical guidance prioritizing safety while helping you maintain leg strength and independence through effective progressive training.